I am Dr. Jose Peiro. I am a pediatric and fetal surgeon, and I am the director of the NYU Langone Advanced Fetal Care Center. As a pediatric surgeon, I can treat any surgery in children, but I specialize in doing neonates, newborns with congenital malformations. Further, I have more specialization in doing surgery before birth. Basically, what I operate is different organs and systems in the fetus in different conditions like Spina Bifida repairs or like congenital diaphragmatic hernia. I do urological obstructions in the fetus. I do problems between twins that share one placenta or fetal tumors. So I can operate many organs and systems in the fetus. We have all the cutting-edge surgical techniques. We have all the diagnostic imaging tools to provide this comprehensive evaluation, like 3D ultrasounds. We have fetal echocardiograms and also fetal MRIs. With all that and good genetic assessment, we can provide a very accurate diagnosis to the families and then propose different options for doing fetal surgery, just to try to improve or fix the condition. All these services we provide in the NYU Advanced Fetal Care Center are focused to help families with these difficult times after this diagnosis. So the idea is to travel with them in this journey from the diagnosis, the evaluation, the prenatal therapy, until the delivery and further. Fortunately, after many of the fetal surgeries, we obtain good outcomes, and most of the babies can do a normal life with a good quality of life.